Hi, Paul here, and in this video I'm going to be talking about the relevance of the resources that you cite. You'll have to learn how to critique the journal articles that you wish to cite in your own papers for currency, checking how recently that it was published, and this is something that differs depending on the topic that you're writing about. For instance, if you are writing about drugs, drug information changes constantly. You probably don't want to be citing resources or journal articles that are older than 5 to 10 years. Whereas for something like anatomy hasn't changed in a long time, it's okay to cite the older articles. It really just depends on your subject. Check whether the information is relevant to the question you want to answer, whether the information being presented is in fact, or whether it's just the opinion of the author, and also whether the data actually addresses the question you want to answer. Check the authority of the resource, and one way to do that would be to see whether the journal article is reporting the results of actual research, in which case it's a primary source, or whether it's an article that is reviewing other studies that have been done, in which case that would represent a secondary analysis. Another way to check for the authority of the article would be just do a search for the author's name in a database like Scopus or PubMed and see what else they've written about the topic. Are they qualified to be writing about this subject? You'll want to check for accuracy as well, and one way to do that would be to critically appraise the scientific validity of the research presented in the article. In the Himmelfarb Library website, we have a research guide titled Critical Appraisal of Research Articles. I'll give you a few tips to get started. And finally, check the coverage of the information as well. Does this represent new knowledge? Does it replace or update some existing information or guidelines? And are there still gaps in the evidence base? When you're prepared to search databases for journal articles, there's a mnemonic that will help you, and that's PICO, P-I-C-O. The P just stands for patient or population, the I for an intervention to be applied, the C is a comparison if there is one, and the O is the outcome to be measured. You might want to structure your thinking about a search before you begin in this fashion if you were looking for journal articles about treatments and interventions. So let's apply PICO to a public health scenario. A group of children come down with the measles. The parents are concerned about the health risks of vaccinations and decide not to have their children receive the MMR vaccine. You need to develop an education program to increase the likelihood that those parents will vaccinate their kids. So thinking about this problem situation, the population is going to be the parents of children with measles. The intervention is the education program. The comparison would be a parent group not educated, and the outcomes you want to find are an increase in the MMR vaccine rate and a decrease in the rate of measles among children. Let's try this again. You're concerned about the number of adolescents smoking in your community and want to find journal articles that discuss successes in smoking reduction or cessation. You focus on adolescents. You are interested in the efficacy of brief instruction versus a session with a motivational interview, and if these interventions will change smoking behavior. The P, the population here, would be adolescent smokers. The intervention would be motivational counseling. A comparison would be the brief instruction or advice, and the outcome would be smoking cessation or reduction. Let's see how you might do this. On the library website, under Popular Resources, click the link for PubMed. In the PubMed website, under the search box, click the Advanced link. This allows you to build up your search in several boxes you see here. So you might start by putting in smoking cessation in the top, and then motivational interview, your intervention, second down, and then click search. In this case, it's brought up 83 results. But I'm going to want to focus this a little bit further on my population, which was adolescent smokers. There are filters on the left of the PubMed results page. One of those would be an age group, but you need to show it because it doesn't show up by default. So click where it says Show Additional Filters on the left, and from the pop-up, check the Ages box and click Show. This shows some ages, but not all of them. So click where it says More, and then from the list, check the Adolescent box, and then click Show. And then adolescent shows up on the left. You can click that and you'll be limiting your 83 results, in this case down to 22 that are affecting adolescents. All limits that you apply on PubMed remain active until you clear them by checking this Clear All box. So if you are going to do a subsequent search on a new topic with a new population, probably a good idea to just clear all of the previous filters and limits that you have applied. Once you find an article you want to read, if you click on it, you get this abstract page. You'll be looking for the full text at Himmelfarb link, which should show up in a blue box in the top right. When you click that, you see this page come up, and you can click where it says Article in order to be able to open the full text and read it on your computer.